This is The Week in Addiction Medicine, a podcast resource of timely news and top stories brought to you by the American Society of Addiction Medicine, ASAM.
Today is Tuesday, June 2nd, and I'm Zach Caruso. Our lead story this week is in the Journal of General Internal Medicine and is titled GLP-1 Receptor Agonist Treatment and Health Outcomes in Methadone-Treated Patients with Opioid Use Disorder and Diabetes. GLP-1 RAs are treatments for type 2 diabetes, or T2D, and have also shown benefits in treating alcohol and tobacco use disorders. Information was obtained from a research database for 9,000 patients with T2D and OUD treated with methadone, of which 1,600 were prescribed GLP-1 RAs. During a one-year follow-up, there was a reduced incidence of myocardial infarction in those treated with GLP-1 RAs. GLP-1 RA treatment was associated with more sustained OUD remissions and fewer overdose events. Patients receiving GLP-1 RAs had fewer episodes of major depression, anxiety disorders, and suicidal thoughts and behaviors. T2D occurs in more than 1 in 5 methadone-treated patients with OUD, and GLP-1 RAs may offer multiple benefits to these patients. Next is an article in Drug and Alcohol Dependence and is titled A Retrospective Comparison of 2 State-Funded Smartphone-Based Contingency Management Programs with Different Incentives. This retrospective study compared outcomes for patients with stimulant use disorder enrolled in a smartphone-based contingency management program according to the amount of total incentives possible, either $75 or $599. The low-value program was based in New Jersey, funded through SAMHSA, and rewarded completing drug testing, attending counseling visits, and completing CBT modules rather than abstinence over 16 weeks. The moderate value program was funded by West Virginia's Medicaid managed care organizations, lasted up to 26 weeks, and largely rewarded negative drug screening results with additional rewards for counseling and CBT modules. Patients in the moderate value program submitted significantly higher rates of negative substance tests compared to those in the low value group. Our next article is in JAMA Network Open and is titled Once Weekly Semaglutide in Adults with Daily Cigarette Use, a Randomized Clinical Trial. This parallel-arm Phase 2A randomized clinical trial of 24 participants examined the effects of semaglutide versus placebo on cigarette smoking, cigarette cravings, and weight outcomes in people who smoke. Participants were non-treatment-seeking adults between the ages of 21 and 65 who smoked at least 5 cigarettes per day. Participants in the semaglutide arm received 9 weeks of subcutaneous semaglutide at a dose of 0.25 milligrams for 4 weeks, 0.5 milligrams for 4 weeks, and 1 milligram for 1 week. There was no statistically significant difference in laboratory measures of smoking resistance or number of cigarettes smoked per day. However, semaglutide reduced cigarette craving and body weight. Our next article is also in JAMA Network Open and is titled Antenatal Opioid Exposure and Cerebral Cortical Maturation in Newborns. Previous studies have shown decreased cognitive and language abilities in children with prenatal exposure to opioids. This study measured the effects of prenatal opioid exposure on the cerebral cortex using MRIs on newborns. Newborns were recruited from an ongoing study of neonatal opioid withdrawal. Compared to unexposed controls, newborns with prenatal opioid exposure had the greatest reduction in cortical surface area in the frontal lobe, followed by the parietal, temporal, and occipital areas. Sulcal depth was reduced in the frontal lobe and parietal region. These effects were greater with prenatal methadone exposure than prenatal exposure to buprenorphine. Prenatal polysubstance exposure produced greater effects than opioid-only exposure. Next is an article in Substance Use and Misuse and is titled Reducing Buprenorphine Misinformation as a Strategy to Improve Adoption in Primary Care. Access to buprenorphine for OUD remains limited despite policy efforts to reduce barriers. This qualitative study examined misinformation about buprenorphine among primary care providers and the impact of a brief prescribing support program. Common misconceptions included that buprenorphine substitutes one harmful drug for another, should be prescribed short-term at the lowest dose possible, and is complicated to manage. These misconceptions were more frequently reported among providers in rural areas and those who had never prescribed buprenorphine. After the intervention, misinformation decreased, particularly among those who had never prescribed. Further research is needed to assess impact on prescribing behavior, but these findings highlight the potential for such intervention to improve buprenorphine access in primary care settings. Our final article is in Drug and Alcohol Dependence and is titled Tianeptine Misuse and Addiction, a Systematic Review of Withdrawal, Toxicity, and Clinical Management. Tianeptine is an atypical tricyclic antidepressant with mu opioid receptor agonist activity not approved in the United States, but often marketed as a dietary supplement and misused. This systematic review assessed reported findings about its toxicity, withdrawal, management, and outcomes. Toxicities resemble those of opioids, including central nervous system depression, sedation and respiratory failure, and death, but also included rhabdomyolysis and acute kidney injury. Reported withdrawal symptoms included nausea, diarrhea, anxiety, paranoia, and hallucinations. Management included naloxone and supportive care for acute intoxication and withdrawal management. Buprenorphine and methadone use were reported for long-term management. The authors note providers should consider tianeptine in suspected opioid-like toxicity or withdrawal, particularly when toxicology is negative for opioids. This concludes today's episode of This Week in Addiction Medicine. Remember to subscribe to the ASAM Weekly for more exclusive content and our editor's commentary delivered every Tuesday. Be sure to check us out on social media and at asam.org. Thanks for listening. We'll be back next week.